Hi, everyone. I'm Dr. Brian Hainline, NCAA Chief Medical Officer, and welcome again to the SSI Spotlight on Mental Health Best Practices. So if this is your first time joining us, welcome. For those of you who have returned, welcome back. We have had two prior sessions. The first one really highlighted mental health first aid and emergency action planning. And the second one really focused on different screening procedures, understanding routine and emergency referral patterns. And we also highlighted telehealth, which is really an evolving area that is going to be very helpful to the membership. Today, we're going to be talking about how to foster an inclusive environment for all student athletes. And we'll be introducing our guest in just a moment, but very briefly, we have Dr. Alicia Tran, who's on faculty at Phoenix College and Arizona State University. And she is a member of the Mental Health Advisory Group and is a representative for the Asian American Psychological Association. We have Dr. Jess Bartley, who's the Senior Director of Psychological Services at the United States Olympic and Paralympic Committee, also a member of our Mental Health Advisory Group. And we have Casey Pick, who's the Director of Law and Policy for the Trevor Project, and also a member of our Mental Health Advisory Group. So why are we doing these webinars? It's really to refresh with the membership the NCAA Mental Health Best Practices, which were first published in 2016. They were last updated in 2020. And they have been endorsed by 25 of the leading mental health, scientific, and licensed mental health care provider organizations in the country. And it's also important to know that the NCAA Mental Health Best Practices are association-wide legislation. When the legislation states that every member school should have in place a mental health policy and mental health organization on your campus that is consistent with the NCAA Mental Health Best Practices. Now, we're planning on updating these further. So the Committee on Competitive Safeguards and Medical Aspects of Sports asked the Sports Science Institute to put together a new mental health advisory group. And as I discussed earlier, we have 3 members with us now. And they also asked us to update the best practices. Part of it was because of a prior summit we had during COVID, which focused on cultural sensitivity issues, really inclusion issues, which is today's focus. How do we have an inclusive environment on your campus for mental health? But CSMAS also recommended that the Mental Health Advisory Group look at the best practices for other emerging areas, such as NIL, corruption in sport, social media, suicide contagion. And also to address some of the issues that came up in recent surveys. For example, that student athletes don't necessarily feel comfortable supporting one another when it comes to mental health, or they don't always necessarily know the best place to get a referral or for an emergency action plan, and that some student athletes are concerned that the schools are not necessarily prioritizing a culture of wellness. So that's why we're doing these webinars, to update you with what the membership already has been doing and to give you a primer for what to expect in January 2024 when the new updated mental health best practices come out. So without further ado, let's turn to our guests. And I'd like to invite each of you, if you could just tell us a little bit about yourself. So Alicia, let's start with you, and then to Casey, and then to Jess.
Thank you. And first, I want to say that it's an honor to be here and to be able to speak about such an important topic. So my name is Alicia Tran. I am faculty at Phoenix College and Arizona State University, as Dr. Hainline had mentioned. I'm also a proud representative for the Asian American Psychological Association on the MHAG. I do a lot of research and outreach to encourage certain science-informed approaches and practices to working with student athletes. And my research examines intersections of cultural identities and minority statuses within athletics, physical activity, mental health, and well-being. And so I focus a lot on racial ethnic minority student athletes as well as other minority student athletes. And I also work with a number of university partners like the Global Sport Institute at Arizona State University, student athlete organizations like the NCAA, and corporate or community partners by giving talks, we're going to corporations like Adidas, things like that.
All right, thank you. Casey?
Yes, thank you so much for having me. Being part of the NCAA's Mental Health Advisory Group has been a true privilege. And as the Director of Law and Policy at the Trevor Project, Trevor is the nation's leading organization providing suicide prevention and crisis intervention services to lesbian, gay, bisexual, transgender, queer, and questioning young people. It has been absolutely an honor to be able to weigh in and try and center the experiences of LGBTQ youth. My day-to-day work as part of our advocacy and government affairs team is to raise up issues of LGBTQ youth mental health from the federal to the state, even down to the local level, bringing to the surface the research that my organization does each year, surveying tens of thousands of LGBTQ young people on a wide range of issues affecting their mental health, including their participation in sport. And so being able to raise up the importance of belonging, of teamwork, of finding welcoming adults and communities is so critical to just building the kind of healthy society that we want and where the NCAA is a leader.
Well, thanks so much, Casey. And Jess?
Thank you so much for having me. I'm Jess Bartley. I'm the Senior Director of Psychological Services at the United States Olympic and Paralympic Committee. And what I do day to day is to help create programming and execute that programming for mental health and mental performance for our Team USA athletes and other stakeholders. I'm coming to the USOPC out of college athletics. And so I have been with a few different universities. And then most recently was actually a faculty member at the University of Denver. And that gave me the opportunity to work with a lot of professional Olympic and Paralympic sports. So incredibly excited to be representing the USOPC on the NCAA's Mental Health Advisory Group and excited to be having this conversation.
Well, thanks. Thanks for the three of you. And it's really been a privilege and an honor for the NCAA to have you as members of the Mental Health Advisory Group. So, when we talk about inclusion on a campus, maybe if you can share right off the bat just sort of what that means to have an inclusive atmosphere for the LGBTQ plus community, for our international students, for our people of color. So often what we've heard is that, well, the facts are that the majority of licensed mental health providers in this country are white, and that there are many who feel that they aren't really included in the mental health discussions, or they don't feel that they're comfortable to even consider themselves included. So maybe share your perspectives on how really these discussions within the Mental Health Advisory Group have sort of widened the horizons about what we can do to have an inclusive atmosphere.
I'll start and then my colleagues can follow on. I think ultimately to be included means that you're seen as all of who you are. So all aspects of your identity are fair. You can be seen that way, but you're not reduced to any one part of them. So by being able to be more inclusive means creating an environment where our student athletes feel comfortable being themselves, and when there is something that happens that directly affects one of their identities, whether that be being LGBTQ, being an immigrant, being a person of color, that they're able to find support and welcome to discuss that need as well. And hopefully that the people who are responsible for providing that support, whether it be the mental health support team, coaches, athletic directors, or trainers, that they are prepared to have that kind of conversation and comfortable doing so.
I'd love to add to that. And so sometimes I think that with the push toward time efficiency, it's often easy to take a universal or one size fits all or cookie cutter approach with something like mental health that you're going to apply to everybody. And that does affect everybody and that does impact everybody, but it doesn't always include everybody truly. And so when you're thinking about inclusivity and reaching minoritized populations, it requires being a little more mindful and strategic. And so it might be things like trying to enlist help from community liaisons or cultural brokers or student athlete advisory groups, but really trying to position ourselves where we can really appreciate being immersed in those specific communities, work with networks that have inroads with those communities that we're interested in targeting, and making sure that we're doing right in that effort. So not only are we impacting everybody, but they're actually included.
And I think the only thing I would add is, in our world and my time in college athletics is asking the student athletes themselves what the best resources would be, trying to include their voices. What are all the identities? And so we've named a number of different identities, and there's so much more. And our student athletes are so incredibly diverse that how do we kind of meet them where they're at in asking their opinions as well?
Yeah, that's great. And look, the NCAA, 1,100 schools, it's not a one size fits all either. But if we just are working with individual member schools, have you seen ways that those that might be struggling to be more inclusive? What are just some of the basic steps? I know, Casey, you talked about that, and you've guided us so much in terms of how to be open to the LGBTQ plus community, sometimes just even starting with the conversation, which is never had. But what are some of the simple initial steps that schools can take?
Some of the simple initial steps, one, just having the conversation. And that does mean including with your students and finding out what their needs are, where they're feeling supported, and where that could be strengthened. Some real practical things, particularly as we're having the conversation about gender identity these days, just simply providing the opportunity for our student athletes to say, this is the name I want to be called, and please use these pronouns. And then not only using that within the athletic department, but maybe distributing that to media who are covering an event or announcers, just to make sure that that is consistently treated the way with dignity and respect for a young athlete. When it comes to mental health specifically, we know that LGBTQ youth are at such heightened risk of depression, anxiety, and suicidal behavior that it's really important that we keep an eye out for these communities and have available specialized services, whether that be directing young folks to 988, where they can dial 3 to be connected to specialized services for LGBTQ youth. 988 is the National Suicide Prevention Hotline. Or ensuring that the team of folks who support your athlete's mental health are trained and possibly even have members who are LGBTQ themselves so that they can really connect with the community and meet them where they are.
And Casey, just so this is a point of clarification, and especially since it was only in the 1970s where the American Psychiatric Association came around and said, well, yes, to be gay, to be homosexual, to be lesbian, that is not a mental health disorder. And so when you speak of the higher rates of depression or anxiety or suicidal ideation in the LGBTQ plus community, you're really talking about how it's been a struggle to really be able to express who you are, or that there actually have been many active things that have been going against someone in that regard. It's not because of their choice, but the community or the environment that they grow up in. Maybe speak to us a little bit about that, because I think that's sometimes misunderstood or not fully appreciated.
Certainly. I wish I could say that the mental health disparities that our community experiences are a thing of history, that ended in the 1970s. But the reality is, despite decades of progress in social acceptance for LGBTQ people, we are currently today in a moment of extreme stress for this community, facing a record-breaking onslaught of hostile legislation and facing just anti-LGBTQ sentiment and even violence targeting our communities. And these are things that we wish our student athletes wouldn't experience when they are within the sheltering arms of our communities, but it can't be left behind. And so it is vital that we recognize that it's nothing to do inherently with a person's sexual orientation or gender identity that puts them at higher risk for suicide or other mental health challenges. It's the stigma. It's the lack of resources. It's the fact that we're all too often carrying at least part of this burden alone. And we do better when we are a part of a team. I think that's something that all athletes know.
Yeah, no, thanks for that. Very well said, Casey. And we just need to keep that in mind. And Jess, I'm just wondering, you're at the USOPC and you're working with athletes from all over the country, sometimes all over the world. And, it has to be challenging to sort of have this inclusive environment when people are in and out and in and out. So what are some of the strategies that you use there?
Yeah, I think we are really trying to create resources that look like our athletes, and we have a lot of providers that share athletes' identities. We are often trying to get into their spaces. And so does that mean social media? Does that mean helping them with name, image, and likeness, training around some different strategies? We try to get out to practices and games and be seen in a part of their environments. I think all of those are really important just to really understand what they're going through day to day. And then just trying to communicate with them in the ways that they do. Is that text? Is that video chats? We have a lot of remote providers. We have really relied on teletherapy a lot. And we've actually found that working across the country and across the world, we really are able to support our athletes. There's incredible resources, again, across this nation and across the world that we've been able to tap into. And I actually joke a lot that this is one space where we don't have to be competitive with other universities or other countries even, that rising tides will lift all boats. And so we work together a lot, and we really try to connect our athletes to those resources that fit them the best, that feel the best, that put them in the best state of mind.
Thanks. And so, Alicia, when we had our cultural sensitivity task force, one of the things that was addressed was that our athletes of color, especially our Black male athletes, felt perhaps more uncomfortable than others in terms of even approaching the idea of mental health. And it was sort of two things. One, it was almost a cultural stigma that, hey, this isn't something I do. And the other is that there just weren't licensed mental health providers that sort of had the background on really working with athletes of color, especially our Black male athletes. So how are you approaching that, and how can schools be thinking about that?
Yeah, you're talking about a lot of points that are so important. You're bringing up things like intersections of identity, being Black, being male, things around race and sexuality. You're talking about being an athlete. You're talking about stigma and all those important things. And those are such important things in this dialogue, and much along the lines of what we've been talking about to this point. It is really important to know why we are doing this. And so, we alluded to it earlier in your discussion with Casey, and, that mental health concerns remain highest among these demographic subgroups that commonly display higher rates of mental distress. So like women, student athletes of color, LGBT minority, athletes, those experiencing, lower SES, structure or financial hardship, those kind of things. And so I think knowing that this is real and that these are people's real lived experiences is really important. The other thing that I think that we need to do is certainly we should work directly with student athletes, and we should certainly directly target student athletes and try and make more inclusive spaces. But we also want to think about other avenues for inclusivity. So one thing to know is that representation not only matters, but it can make a difference when it comes to something like mental health and well-being. And this is a particularly important area where representation can really affect people. I also, as a scholar, I want to make a plug for research and assessment, to understand the experiences and the specific mental health needs of your minority student athlete communities, and what they think might help. And so my experience hearing the voices of stakeholders and student athlete mental health from all over, a lot of athletic departments, is that there is this very profound feeling of wanting to do right by minority student athletes and wanting to help and support their mental health, but not knowing what to do. And that's hard. When you don't know something, doing research and assessing the situation are really good first steps. before trying to jump into action. And so I live in the sphere of student athlete mental health, and I can absolutely say that we are too shy about collecting and reporting on data on race and ethnicity, gender identity, sexual orientation, and so forth. And sometimes we just don't ask. And we need to, though, so that we can talk about this. And we need to get away from that to have a really meaningful impact. And so some of the initial steps I would recommend are things like the cultural liaisons and cultural brokers, student advisory groups, making sure that these minority communities that you are working with are representative, whether it's in your athletic department or some other important area that student athletes have access to, like their faculty, their tutors, their health staff, things like that. And then also thinking towards assessment and research to really put your, finger on the pulse of what's going on and what athletes think could help the situation.
Yeah, that's great. So let's keep that conversation going maybe after the webinar about more research as well, because it's always welcome. When we put together documents, we say it's evidence and consensus based. A lot of times it ends up being consensus based because we don't have all of that evidence. The other thing I'm hearing loud and clear, it's just understanding who is with you as student athletes and just thinking inclusive and asking the questions. It's already a game changer right from the start. So we're going to have these NCAA mental health best practices. We're going to be talking about a lot of the things that we're mentioning in the book, but sometimes the membership says, hey, is there one great resource or program? And I'm not looking for the magic bullet, but for the three of you, have you come across what you think are really good resources or programs that you think are good for the membership to use or easy for the membership to use?
Because I actually don't know that there is a magic bullet, but I do think starting the conversation with those that have kind of been there before you or been in some of these spaces, even if it's in or outside of sport, is really important. And I think that we sometimes get really narrowed around, okay, what does college athletics need? So let's ask other member schools. And, I've just found it's really valuable to go to pro sport. We've worked with a lot of different organizations, with Mental Health America, with a lot of different groups that are outside of sport, which has been valuable. And then I think to circle back to what I said earlier, other countries are further ahead than we are. And so I think that talking with Australia and understanding their system, we've borrowed a lot from Great Britain. They've done an incredible job with Paralympics and disabilities. And so how do we model what is going well from other countries? How do we borrow? And again, this is a place where I've found that we can all joke that we don't want to be competitive. I know we're often really competitive in sport, but how do we gather all of those resources? And I found that using really reputable national organizations, international organizations, using other spaces such as youth sport, pro sport, has been really valuable as well.
In the LGBTQ space, we are really lucky to be living in a time when there are so many more athletes and former athletes who are coming out, so that we know that we can talk to folks with actual lived experiences as LGBTQ athletes. So I would reach in to connect with those folks. And organizationally, Athlete Ally. I can't give a higher endorsement than to our friends at Athlete Ally. Spoiler, they also have a representative on the Mental Health Advisory Group, but they do tremendous research. Getting outside of the sport realm, the professional associations for mental health and just medical organizations are also tremendous allies lately and have organizations within them specifically for LGBTQ providers. So I would look at the APA, the AMA, and see what resources they're creating just for mental health support for LGBTQ people and see how that can be tailored to the athletic context. And finally, the business world. Employers have been looking at ways to create inclusive environments because they know it's best for the bottom line. And so if the business world, if the corporate world is finding ways to make a space where their employees all feel like they can bring their best to the workplace, I think there may be some translation there as well to the athletic context to let our athletes bring their best to the field.
Yeah, that's a great point on that. The business model too, it can work. So Alicia.
Yeah, I think these organizations are all really fantastic ones. I want to mention a few universities that I'm aware of and programs at universities that I have at least read about, but there are a number of universities that have their clinical mental health professionals, like team psychologists that are embedded in their athletic department. And so one I've read about is University of Pittsburgh. And having this, this is not a new idea, but having in-house mental health can be really profound. And not only just providing direct mental health services and accessible mental health services, we'd hope to our student athletes, but getting away from that outpatient model, having a more full-time embedded team that really makes mental health a priority. One of the things that I've seen come out of that program that I'm aware of is that they were able to then offer coursework around wellness and resilience and life skills that directly worked with student athletes, taught them some really useful clinical mental health skills. And then, if you think about that, so having these courses that student athletes can participate and learn about these mental health coping skills, just imagine how that can grow and expand and what that can do and where you can go from there. So I think that that kind of programming can really be a great starting point and become more dynamic. I am aware of University of Virginia. Their athletic department has spoken about partnering with local mental health and wellness nonprofit organizations to offer training sessions for athletic coaches and staff. And this is something that a lot of us have been talking about with the mental health advisory group, that we want to reach out to coaches. We want the athletic directors. We want everyone to be in this community of care where they can see mental health concerns and intervene and know what they're looking for and know where they can provide resources and what resources to provide. And I would say that this one is actually very feasible for a lot of universities, because I do believe that a lot of organizations would jump at the opportunity to help athletic departments if given that chance.
Yeah, we so often forget the community resources or, state resources there are there, and it's just a matter of asking, and sometimes the help is a lot easier than we thought. So let's say, I'm at a school and I've made a decision, okay, we're going to really have a much more inclusive environment, especially with regard to how we approach mental health. What are ways that I can know if I'm succeeding? And, maybe just some simple sort of measures or way that you measure success.
I was just going to say, for us, it's been really simple. We've gotten swamped. And so it's, that we get really busy. We have a lot going on. We have a lot of touch points with athletes. And I think we've created a lot of those touch points. And so we're administering the International Olympic Committee's sport mental health assessment tool to all of our athletes and their health history. So we have a lot of touch points. We've gotten to know the athletes a bit. And then they follow up with resources. And I think then the follow through has been really important. So if we give an athlete a referral, whether it's internal or external, we follow up in 1 week and then we follow up in 1 month. We ask them how it's doing. So just how's it going? How's the provider? How's therapy? How's treatment? Do you need anything different? And so we've got a lot of different touch points where we're able to ask athletes how they're doing. And then especially if it's internal, we're also asking them around their symptoms and our symptoms reducing. And so again, we've just continued to ask the athletes, are things improving? Are you satisfied with services? Even a one-off workshop, it's how did it go? Did you get what you were looking for? Can really go a long way. But I think that that's where at the USOPC we've grown pretty quickly, as we just continue to understand that there's a need and a demand, and the services become more popular and the athletes seem to be really satisfied with them. So that continues to give us really good data and information on what we may be doing well.
So I was beaming when you were asking that question, because I really wanted to chime in assessment and research and make a big plug for assessment and research. But here's the thing about it: as much as a research person as I am, your research is only as good as the data you have. And so in terms of if there's one specific question that I think would assess it, I don't think there is. I think what you need is to ask the communities and your cultural partners, the athletes themselves, what would be good ways to evaluate things. You ask them their language, the slang that they use, the verbiage that they use, I think is really important so that we can get at it. So somebody may sooner say that they're feeling stress rather than feeling anxious or depressed or other clinical terms that we're really comfortable with. Some other people may be more comfortable with saying that they're going to go get some coaching rather than go to therapy or have a therapist or psychologist or psychiatrist that they're working with or whatnot. And so I really think to get at some of those concepts, you really have to work with cultural brokers, and that maybe the athletes themselves or community partners who are in those minoritized communities that you're interested in, to really get at what's a useful thing to ask about. How would they talk about this? How would you say this to other people so that we know that we're having an impact and that mental health is getting better and people are feeling included?
Listening to Jess talk about how you're succeeding because you're swamped, part of that raises for me some of the concerns of, well, who are we missing? Who's not showing up in that? Because we know the demand for mental health support right now is so very high among young people. And so my advice is to, especially for some of our communities that we know have reasons to avoid seeking out care, remove as many barriers as possible proactively. For LGBTQ young people, we know that more than 80% in our survey told us they wanted some kind of mental health support, but more than half of them couldn't get it last year. And we asked them why. What were the barriers? In some cases, like we see across the population, the barrier was cost, but there were also unique barriers to our community. Fear of having their sexual orientation or gender identity be disclosed, fear of discrimination, fear of not being understood, fear that their information wouldn't be private. So some of this is material that as you're trying to do that kind of outreach, making sure that folks in communities are not overlooked as you're dealing with the swamp of demand from everybody, is trying to proactively remove those barriers, message the importance of confidentiality to this experience, and be able to answer ahead of time, like, what will this experience look like and why can you trust the people that you're going to for help? And also, Alicia, I'm right there with you on the issues with data. We know that there are communities that it's just harder to collect data on, especially if we're not asking the questions up front. And so even that process similarly has to be explained. Why are we asking these questions? Why do we want to know? So that we can get you the resources you need. Just being able to provide that explanation up front, remove some of the barriers to care, and then you're more likely to be able to actually connect with the communities that we know are at heightened risk.
Well, this is great. Thanks so much. As we're wrapping things up, how would you all approach at a campus level the difference or similarities in making certain that, as best you can, that the coaches are well informed of an inclusive environment, and that the administrators are, the physical therapists, the athletic trainers, the team physicians? That's probably not a one size fits all, but athletics can be very busy. How do you kind of making certain that it interdigitates at every level of athletics? What are some of the approaches that you take?
For me, I start with letting folks know that when it comes to LGBTQ young people, having one accepting adult in their life, and that can be a coach, it can be a trainer, it could be the athletic director, but having one adult in their life that they know accepts them for who they are can reduce the likelihood of a suicide attempt by 40%. I have all kinds of data, but that one hits home so folks know that this work matters. And calling things out by name, welcoming communities specifically, matters. Also, I really try and emphasize that the mental health of the adults around a young person, mental health of the people that they respect, their coaches, goes a long way to influencing their day-to-day lives. If you aren't healthy, you can't pour into somebody else. And also, you're a role model. So if young athletes see that you take your mental health seriously, that gives them permission to take their own mental health seriously. And in a time when we're still facing really high levels of stigma for seeking out help, at the Trevor Project, we hear every day, 24/7, 365 from young people who are brave enough to ask for support. And I try and emphasize that it is a matter of courage and bravery to ask for the help you need. And there's nothing braver.
Yeah, when I think of that question, I think about things like having awareness about the reality of issues like racism, sexism, heterosexism, transphobia, many of those things like that. And that awareness is really important. And a lot of times we think about something, I'm just going to use racism as an example, okay, as this individual one-on-one act of aggression. But we have to recognize that hostile cultures of racism, as well as sexism, homophobia, transphobia, etc., exist. And it's possible that our own athletic or school cultures may have elements that enable such hostile environments. And in that case, then coaches are responsible. Athletic directors are responsible. Athletic staff are responsible. Admin at the university, they're all responsible because we all are a part of communities. And so when we think about the culture that's in our community, that's really important. And we have to think about the possibility that sometimes these experiences that get away from inclusivity can be really subtle. And so we talked about, you asked me about Black male student athletes. And one of the stories that I've heard from actually a number of Black male student athletes is having athletic staff come into the locker room and say things like, turn that, I'll say junk off when they're playing rap music, or something that is more, that they're, is part of their culture. But the problem with that is that this is a devaluation of culture. And it's saying that this culture, this racial, ethnic, minority student athlete culture is less than. And so then we're getting away from that inclusivity, and we're getting more towards cultural hostility. And so sometimes we can diffuse responsibility when we think of things like racism or sexism as a one-on-one, like, well, I didn't do that. I didn't say anything offensive. But we also want to think about, did we enable, did we let there be, do we accidentally or unintentionally say things that might not have made a comfortable, inclusive space for people to be their themselves and all of who they are. As I think about Casey's initial answer to what is inclusivity. And so sometimes this is really subtle and it's really hard and it's really challenging, but it is worth it to just step back and take ownership over the possibility that you may be a part of a culture. And that's actually really cool. That's exciting because athletic culture is super exciting and super powerful, but there are some responsibilities that come with that, and that's making sure that everyone in the community is part of it and feels a part of it.
Yeah, and I think what I would add is how to tie those together. I love what Casey said about the power of what a coach or an administrator could be in a young LGBTQ plus youth life, and there's a lot of power in also thinking about their mental health. We've, at this point in the last couple of years, trained over 700 coaches and administrators in mental health first aid. What I've found really valuable is a lot of times they just want to know how to help. And so to say, you actually do have the power to help, to make a change, to make a difference. And to also piggyback on what Alicia's saying is you have the power to change. You have the power to change culture. You have the power to do this. And I think to bring it all together, we've been doing a lot of workshops around mental health first aid, or how to build culture, how to build inclusive culture. And again, I think the bottom line in all of our trainings really is how powerful a coach or an administrator can be in these environments, how much they can influence the culture, the athletes, the university. And so I think that a lot of times they may feel powerless, but giving them small things. And so, for example, in the mental health first aid training, we're often saying, you may have an athlete who is historically early, always early, and all of a sudden they start coming on time. You're probably going to be the only one that notices that. And so is there something going on with their mental health? Is there something going on with their life, in their life, in their culture, whatever that might be? And so I think to just have small examples like that is the coach maybe the only one that is noticing, because the athlete's not tardy, they're not late, but something in their behavior has shifted, which may also indicate that something larger is going on. And so empowering the coaches, the administrators, the staff, medical, you name it, to notice those small things and to understand how to talk about it, how to understand what the athlete may be experiencing, and meeting them where they're at can be so incredibly valuable. And that really can shift mental health and also culture.
Well, I feel like we're bringing everything together from the two prior sessions. We talked a lot about mental health first aid then, and one of the coaches talked about how he's even now taking care of himself and is allowing himself to go out fishing, whereas before that was felt to be almost a sign of weakness if you were taking time off and trying to relax, and also the importance that of saying, well, now the coaches really are seeing things that they didn't before, and so. We spoke in the first session about how coaches are the single most important influence on athletes in general. That's the data we have. And so empowering the coaches and with this sort of responsibility and ability to be part of the team effort, it's really exceptional. So, well, look, this has been so wonderful to be with, well, my colleagues and my mentors, part of the mental health advisory group. Really appreciate your taking the time, sharing your insights. And now we're going to have the opportunity to take some questions from the audience. You'll put them in the chat feature and then we'll be addressing them. So thanks again to our guests and we'll now go to our live Q&A. So thank you, everyone.